Hello, everyone. I am Anita, the AI assistant, who will be hosting this collaborate session for Week 7. Today, we're going to explore a vital yet often misunderstood aspect of healthcare: hospice and palliative care. These services play a crucial role in enhancing the quality of life for patients facing life-limiting illnesses and their families. Our journey today will help you understand what hospice and palliative care involve, who benefits from these services, and why they are essential in human growth and development. We aim to demystify the philosophies behind hospice and palliative care, illustrate how they support patients and families through challenging times, and discuss the psychological and ethical dimensions involved. Let's begin by defining what each of these terms means and how they differ. First, let's clear up some common misconceptions. Many people use the terms hospice care and palliative care interchangeably, but there are important distinctions. Palliative care is specialized medical care for people living with serious illnesses. This type of care is focused on providing relief from the symptoms and stress of the illness. The goal is to improve the quality of life for both the patient and the family. Palliative care is provided by a specially trained team of doctors, nurses, social workers, and other specialists who work together with a patient's other doctors to provide an extra layer of support. It is appropriate at any age and any stage in a serious illness and can be provided along with curative treatment. Hospice care, on the other hand, is a form of palliative care for patients who are nearing the end of life. When curative treatment is no longer expected to be effective, and the patient is expected to live 6 months or less, hospice care may be recommended. Hospice care supports the patient's emotional, spiritual, and cultural needs while managing pain and symptoms to allow them to live as fully and comfortably as possible in their final days. Importantly, hospice care also helps families cope with the impending loss and provides grief support. The concept of hospice care has deep historical roots, dating back to the Middle Ages when hospice referred to a place of shelter for weary or ill travelers on a pilgrimage. The modern hospice movement began in the 1960s with Dame Cicely Saunders in the United Kingdom, who introduced the idea of specialized care for the dying that addressed pain and prepared families for death. This concept spread globally, reshaping end-of-life care. At the heart of both palliative and hospice care is the philosophy of total care, caring for the whole person, not just their symptoms, but also addressing emotional, spiritual, and psychological needs. This approach is rooted in the belief that each day of life has value, and that patients at any stage of a serious illness deserve to live with dignity and comfort. Palliative care may include medical treatments, such as medication for pain and symptom management, nutritional support, and other therapies aimed at improving comfort. For example, a patient with cancer might receive chemotherapy to alleviate symptoms, even if the cancer is incurable. Psychologists and counselors play a crucial role in palliative care teams. They provide emotional support to patients and families, helping them navigate the complexities of serious illness, which often involves making difficult medical decisions and coping with the fear of the unknown. Social workers assist with the practical concerns of living with a chronic illness, like insurance issues, advance directives, and funeral planning, while chaplains or spiritual advisors provide support that aligns with the patient's spiritual beliefs, helping them find peace and meaning as they confront the end of life. When a patient transitions to hospice care, the focus shifts entirely to comfort rather than cure. This transition is often challenging for patients and their families, as it involves acknowledging that death is approaching. Hospice teams are skilled in providing the necessary support during this time. Hospice care teams are specially trained to manage the unique needs of end-of-life patients. They ensure that patients are free from pain and discomfort, that their environment is calm and comforting, and that they are surrounded by their loved ones in their final moments. Support extends beyond the patient in hospice care. Families receive counseling, help with decision-making, and comprehensive bereavement support, which continues after the loss of a loved one. This holistic approach helps families navigate their grief and start healing. As we conclude today's lecture, remember that both hospice and palliative care embody a compassionate approach to healthcare. They ensure that individuals facing the end stages of life are treated with dignity and respect, and that their families are supported throughout the process and beyond. These services are not just about managing physical pain. They are about enriching quality of life, however much time remains. Thank you for joining me today, and I encourage you to reflect on the important role these services play in the cycle of human growth and development.